So first I would check my order, make sure that it matches the doctor's order for that we're going to do a central line today. I'd make sure to grab my different things that I'm going to need in the patient's room. And then I'm gonna go into the patient's room. I'm gonna knock, bring this around, it's so heavy. Okay. Hi, my name is Sophie. I'm gonna be your nurse today. I'm gonna do some hand hygiene. And can you tell me your name and your date of birth? Awesome. I'm gonna close the curtain and check the room so that the patient is safe and has privacy. I'm going to raise the head of the bed up, and while I do, I'm gonna explain to my patient that today I'm going to be doing dressing change and flush of their central line. I'm gonna break the table. I'm gonna place my patient into a comfortable position, which they've stated today they wanna be lying flat. I'm now going to put on my patient's mask. Okay. This has to move. And make sure that that's secure. And I'm also going to place on my mask. Just gonna move that out. I wouldn't have more than what I need in the room. And I'm going to ask the patient to turn their head away from the site. And then I'm going to move this down. So I'm only exposing the parts that I need to, but keeping them covered with a blanket to feel private. I'm now gonna put on my clean gloves and get ready to remove the wrapper. This mask is all up in my business. Okay, these are kind of tough on the mannequin, so my technique is just going to be to make sure to hold the middle while I remove around the site to ensure that I'm not pulling off the insertion or out the central line itself. And on a normal patient, I would not be this aggressive, but these mannequins are so sticky. Okay, I don't know why this is so hard. Okay, once this is off, I would assess it if there was any gross drainage, any concerns, and I'm gonna put it in the garbage. I'm gonna palpate the site around the area for any tenderness, pain, or discomfort, and ask my patient, are you feeling anything that's uncomfortable at this time? I'm also going to remove this antimicrobial thing around the site and make sure that the patient holds really still so that this doesn't fall out. I'm now gonna remove my gloves, and for my sakes, I'm just gonna set these over. I would have like a table or something else, but I'm just gonna move them out of my way. I've got my kit and my flushes, some alcohol prep pad, and my thing. I'm gonna do hand hygiene. And just because that site has to stay sterile, I'm gonna open my sterile kit. And I'm gonna open it away from me. Pull this out. Maybe I do want these all to be over here. This can go in the garbage. I'm gonna open my kit away from me, making sure that no part touches. And then I have that 1-inch sterile border on the outside. And this just doesn't want to cooperate. Okay. I don't need this mask, so I'm just gonna throw that in the garbage. I could even set it on the table next to me in case I felt the need for it. And then just holding that 1-inch border, I'm just gonna slide this to the side, and I'm gonna grab out my gloves. All right, I'm gonna put on my sterile gloves. If I can get this to open. Okay. If I can get these to function today. My without touching that edge. I'm gonna go under. And then with my elbow, I'm just gonna move that out of my way. So the site is exposed, so I'm gonna grab my ChloraPrep out. And I could do I would probably use 2 different types of prep just to make sure that the area is super, super clean. So I'm gonna break this and get it squeezed into that thing. And I'm going to grab a gauze, since I haven't touched the site yet. And with my non-dominant hand, I'm going to lift up these lumens to get them out of my way. And I'm going to clean in like an aggressive but gentle at the same time motion to ensure I'm not hurting my patient, but I'm getting the site extra clean. So side to side, up and down, all around the edges. And then I'm gonna go in a circular motion, making sure that I really get this area nice and clean. And I'm also going to scrub up and down the lumens that touches the patient's skin so that they're nice and clean, and then I can let those go. They did touch my glove, and if that was the case, I would change my gloves if they were not sterile to obviously maintain sterility for my patient. My glove is sterile at this point, so it's not a concern. This would go in the garbage now, and same with this because I don't need it. And now I'm going to, since I've cleaned around everything, I'm just gonna remove some things out of my way. So I've assessed the patient, I've made sure everything looks good. I'm gonna make sure that we're good. And then I do need to let the area dry to apply a new bandage. So, trying to think if I'm missing anything. I feel like I am. Just gonna move some things out of the way. Okay, I'm gonna grab my Tegaderm and get it ready to place on my patient by removing the sticky side. Okay. And with this hand, I'm gonna move these up so they're sitting on top. And since this is the wrapper, I can grab it. And I'm gonna place it on top of the site, making sure it's stuck on all edges. With the mannequin, they're still kind of wet, which is super difficult, but it is going to stick. And then I'll remove my border, just sealing everything down to the patient's skin. Okay, I probably should have mentioned that when cleaning the patient's skin, I would have cleaned for about 30 seconds, let it dry for that same 30 seconds to make sure everything was good. So my hands are not sterile as we know at this point, so I'm gonna remove this and I would label this with a pen, and then I'm going to take this off, and this is going to be stuck on the outside of the thing so they know when I changed the bandage for this patient. And now I'm gonna get ready to clean the area. So for the sakes of gloves and a Passoff, I'm not going to change my gloves, but in all reality, I would put on new sterile gloves to ensure that when I was flushing, aspirating everything outside of the lumens themselves, that I was not causing an infection to my patient or causing any problems. So now I'm gonna get ready to do that, and I'm just gonna move these over to the side a little bit, and they would be clamped off. I'm gonna get my flush and my alcohol prep pad. There are alcohol swab sticks, but I'm gonna use a prep pad. It's the same thing, and I'm just gonna take these open. And I would remove these caps. I am going to save them for the sake that we don't have more, but I throw these away and get a new cap because these have a alcohol pad basically inside of them to keep the tube sterile. So I'm gonna remove those, and I'm going to clean these off super, super well. I would grab a new alcohol pad and I would clean this side super, super well. Okay, put that in the garbage. Then I'm going to start by connecting this on, and this wouldn't have normal stuff in it, so I would aspirate a little bit. It would have saline. I'd make sure that I'm still in and everything's intact. Make sure that I'm unclamped. And then in a pulsatile action, I'm going to administer that saline into the lumen. And once I am done with that one, I would throw that away or just throw it away. And I put on a new clean cap. I'm gonna do the same with this, so making sure that my area is clean. I'm gonna alcohol wipe it off. I don't know if necessarily sterile gloves are even needed for this, as I am moving different things around, but I feel like I'm gonna do everything in my power to keep clean and sterile. I'm gonna aspirate that fluid again. In a pulsatile method, I'm going to push in that normal saline, and then I'm going to apply that cap as needed. I'm now going to make sure that I clamp everything back off and that my patient is comfortable. Make sure that everything is secure and that they feel okay. I'm going to raise the bed back up and lower them to the lowest position possible. At this point, I can remove my mask and my gloves once the patient's safe, and I can let them know that we can remove their mask as well. Everything is back to being covered, and then I would go document the procedure, ask my patient if they need anything else, and I'm done.